Since 1996, one of the more common procedures performed at the Duke Eye Center is laser vision correction surgery. At the Duke Center for Vision Correction, LASIK is the most common of these. Patients are given a topical anesthetic as well as a sedative for any anxiety that they may experience. The new 60 kilohertz femtosecond laser makes LASIK at Duke a completely blade-free operation. Patients are given a topical anesthetic drop as well as a sedative to control any anxiety that they may experience. Patients commonly report feeling some pressure around the eye at this point in the procedure. We purposefully keep our laser rooms very cold, and that's why we give the patient a blanket. Here's another view of the procedure that takes on average about 19 seconds to perform. Those are very tiny gas bubbles that are forming within the corneal stroma. Once this is completed at the very end, there'll be a side cut, keeping the hinge at the bottom part of your screen. Once the flap is created, the patient is then moved to the excimer laser, where the flap is gently lifted, exposing the bed. You can see that the surface is smooth, it's dry. The patient at this point is instructed to look at a flashing light. The reticle will come on shortly, and that has to do with positioning the laser as well as the tracking of the patient. The tracking is a very important part of the procedure. As you can see, even with the heart rate right now, the eye moves very slightly up and down, and the laser is tracking that movement and making adjustments, usually between 3 and 6 adjustments per pulse. Again, the patient's not feeling anything at this point, and they were only seeing the flashing light, the fixation light, as the laser itself is a wavelength that is outside of what we call the visible spectrum. The flap adheres within 2 to 3 minutes, making this a 19-minute procedure for both eyes. We examine every patient prior to leaving the Duke Center for Vision Correction.